Hello, this is Dr. Gay from First Look MRI, and this is a 62-year-old male with shoulder pain. They have rotator cuff tear and other significant findings, but they also have a funny region of abnormal signal in the posterior joint. This is the humeral head, this is the glenoid, here's posterior, and we see this area of, looks like low signal intensity surrounded by fluid in the posterior joint. And the question is, well, what is this? On this one view, you say, well, they did fall recently. This could be a hematoma, could be some synovial pseudomass, or some synovial proliferation. But it does mirror fat on this. Here's suppressed fat, and there it is. Now we're going to look on the T1 images. And a bit hard to see, but here we are in the middle, and we're going to go posterior. And right there on the T1 images, we see it right in here. So this is just like fat on this sequence as well. And now we're on a sagittal stir sequence, and here's the process in the posterior joint, and that also looks like fat on this sequence as well. And then lastly, we have the T2 weighted sequence, and we see it back over here, and it also looks similar to fat. So since it's similar to fat, here it is right there on all sequences. This is most compatible with Lipoma arborescens, and this process is benign. It represents villus lipomatous infiltration of the synovium. And we see it in the knee not infrequently, and it's usually in the suprapatellar pouch with these nodular synovial fronds. But in the shoulder, it's very, very rare. Just did a literature search, and there's a couple case reports, but just not a very common thing to see within the shoulder. And that's it. Thank you very much.